Hi, my name is Jerry Cahill, and today I'll be speaking to Dr. Germana, and we will be speaking about the H1N1 flu. Hi, Dr. Germana. How are you today?
I'm great, Jerry.
Can you tell me a little bit about yourself and your background?
So I am the CF Center Director at Schneider Children's Hospital. I came here about 12 years ago. I've been involved in CF for about 19 years, primarily in the role as a CF Center Director.
Let's just talk a little bit about the difference between the H1N1 and the seasonal flu, and what is the big difference between the two?
So the H1N1, as we know, appeared basically last spring. And it's a little different in terms of the people that are most affected by it. So the typical seasonal flu is really a problem for young children and older individuals, say above 65. Primarily with H1N1, we're seeing what we learned from the spring season epidemic. We learned that really younger people, particularly under 25 years of age, are at higher risk for complications.
So let's talk about the symptoms of the H1N1.
What we saw was there was a lot more GI symptoms, and GI meaning your gastrointestinal. So we saw kids, rather than just the fever, the sore throat, the runny nose, and just this extreme lethargy, the other thing we really saw that was interesting was this whole nausea, vomiting, diarrhea component, which is very unusual for the regular seasonal flu.
We're talking about prevention and transmission of H1N1. The bottom line is, how is it transmitted?
So it's transmitted by droplets. So when a person's, as an example, a person's admitted to the hospital, we put them on droplet precaution, which means gown, glove, and mask if you're going to be entering the room and near the patient. So basically how it's, people sneeze or they cough on their hand and they touch objects, and then you touch them, and then you touch your hand to your face. So this is why I was saying about the glasses are a great guard against things going in your eye, and a scarf if you're, if you can in a public, setting, have a scarf, like if you're walking or in a mall or something, that would also prevent droplets from getting into your mucous membranes.
Give us your top 5 recommendations for prevention.
Wash your hands as often as possible, certainly before you eat. Certainly anytime you touch an inanimate object, you should definitely try to wash your hands. If you don't have access to water and soap, then use an antibacterial lotion. They're readily available. The next thing I want to do is try to avoid, obviously, sick contacts. So that requires a little bit of forethought. So, if you're going to a party, it's the holiday season, you definitely want to call ahead and ask if anybody's been sick. Or is somebody actively ill. The third thing is try to avoid sick contacts. Certainly anyone who you believe has H1N1, try to avoid close contact with them. Get plenty of rest. It's one of your best ways to prevent getting sick, and make sure you take your vitamins, especially vitamin D, and good nutrition.
And what recommendations do you have for travel?
The data on air travel is that people actually do not develop more illnesses related to air travel. I know there's probably a lot of sort of wives' tales out there about that, but in fact, you don't. So if you want to get on as late as possible onto the plane so that you're not sitting in that sort of dry, recirculated air, that's a good idea, and try to get towards the front of the airplane so you can get off quickly, so you spend less time in that kind of intimate environment. If you hear people obviously coughing and there is the opportunity to change your seat, go right ahead. Don't presume it's an infection, of course, but definitely drink plenty of fluids when you're on the plane, and make sure you wash your hands or use the antibacterial when you're on the plane.
So it's not really necessary to wear a mask on the plane?
I think if people are anxious and that helps them, then do it, but I'm not certain that it's necessary.
If you believe you have the H1N1 flu, is there a test that you can get to confirm that?
So yes, there is a test, and the test should be done as quickly as possible when you have symptoms. So preferably within the first 24, 48 hours, you should call your CF center and they should make a determination with you whether you should come in for testing. Most CF centers are hospital-based, and so they will have access to the type of media that's required to do the testing. And then the results of the testing, there's a rapid test that comes back usually within, depends on the place, but our hospital could be as quickly as 30 minutes or within a day. And then there's another test that can take up to about a week to come back. And then a conversation needs to occur about whether you, the patient or your child, should have antiviral medication.
There's a lot of talk in the papers and the media about H1N1, and you hear these scary stories out there. Where do you recommend people go to find out more information about H1N1?
The first place for people to become informed is their CF center. The second place is, if you want to go on the computer, you can look up Center for Disease Control. They're an excellent resource, as well as Cystic Fibrosis Foundation and the Boomer Esiason Foundation, where you work.
Okay, so if you are exposed, what is the incubation period?
So the typical incubation period is 2 to about 7 days from the time you were exposed.
So within that 2 to 7 days, you should get the symptoms if you're going to get them.
Yes, and hopefully if you've been vaccinated, you will either have none or very mild symptoms.
How long of a period of time is it contagious for?
We usually tell people with all viral illnesses that you're considered contagious for about 2 days, 3 days before you become sick, and then you're contagious until you've had no fever, essentially, for 24 hours. So the person's, H1N1, you can have fever for 5 days. So during that period of time, we would still consider you to be contagious.
If there are confirmed cases of H1N1 in my child's school, would you recommend that I take my child out of the school?
I think that's a question that we all wrestle with as parents, as well as CF care providers. How much is too much? So it's important for parents to get as much information as they can from the school, and that can be kind of difficult. But if they can speak to the school nurse, and she can kind of help them with where the cases are in the school. Are they in my child's classroom? If they are in my child's classroom, how many cases are there? Certainly children in the younger grades, they share a lot more time together, sort of all over each other and sharing similar toys in the classroom, compared to people like, in high school where they're in different classrooms, and they're not with the same people. So the important thing is to really be in close contact with your school and get as much information about the number of people and how intimate the contact is potentially, and then give that information to your center and make a decision about what's the best thing to do for your child.